going with today's event. So welcome everybody to join us. My name is Anne-Marie Parent. I'm a volunteer with the Healthcare Hub at SI Innovations. And today we have a great event planned for you. We'll hear from Lesh from the CareLab and from Rosina from the Living Lab for Health. What we're doing is both Lesh and Rosina will share with you case studies of how they've applied systems thinking tools in the work that they do. And once we hear from them, then we will engage in a conversation with all of you about insights, about what you're learning, and kind of guiding us in the next steps of our work around this. So that's what we have planned for our conversation today. What I'd like to do is I see there's some folks who've joined us, and it's always great to know where people are joining us. So if folks would want to take a moment just in the chat to write your name and where you are joining us from today, that would be great. And as you are doing that, I'm going to pass on the floor to Lesh to start talking about the CareLab and the great work that she's been doing.
Thank you, Anne-Marie. And let me just, can I share screen to get started? Yeah?
Absolutely. Go ahead.
Give me a second. Okay, well, first of all, thank you to Rosina and to Joss for a conversation and a meetup that led to this event and for inviting me to join you. I'm actually here. I see one of my colleagues, Ada, is on the line as well. We're very happy to be here as the CareLab, and I want to share today the work that we're doing as a team and as a practice that we call people-powered care system transformation. But I'll start off maybe by a little bit of introduction. So we are care activists who happen to be designers. Now, the reason for that positioning comes from a long journey where we began in healthcare as design consultants, specialized in healthcare innovation, products and service innovation. And over the last decades, we realized that we had a lot of frustration around our work, and we wanted to do more, to stay longer with transformation work, to really see the impact. And we had a point of view that came up within each of the projects that we were doing. And we realized that we were in a silo in healthcare and that we wanted to look at care in a very broad sense. So to look beyond just healthcare systems, but look at social care systems and even education systems. So for us, care is a transversal topic, and it impacts the way we live our lives from birth to death. And the activist position is because we are a mission-based practice. There are specific topics that you'll see through some of the case studies that I'm going to share. And it allows us to find partners who are interested in driving forward around the same mission. And so as designers, we come to join forces with very different disciplines. And I won't go in detail right now, but I would really encourage you to check out some of these networks that we are part of. The Patient Revolution, which is fighting for careful and kind care. It's based in the US, a spin out from the Mayo Clinic, a nonprofit that is made up of healthcare professionals and patients working together. Compassion Revolution will be there in November in Adelaide, Australia. They are a group of healthcare professionals within that particular healthcare system who want to bring compassion back into their work, to fight burnout, but also to deliver more compassionate care. And Xarxa Forum Social de la Cura, for those of you that are in Catalonia, where we are based in Barcelona, this is a social movement we're part of to call for a national system of care. So all of this to say that we are quite proactive in our practice. I think you'll see that through the examples. And we need partners to really have an impact and to drive change. So how do we engage? Because I think today is about sharing how we operate as a lab, as the CareLab, but also Rosina as a living lab at IrsiCaixa. So the CareLab, how do we work? I mentioned that there are a number of missions that we care about. I'll give an example. We are fighting the taboos that exist around death, dying, and grief. So a lot of work around palliative and end-of-life care. We're also big advocates for the for informal caregiver and formal caregiver. So that could be a family member, but it equally could be a healthcare or social care professional. So we believe in caring for them in order that they can better care for others. We have a belief that community-based models of care are really the way forward. So to move care beyond the walls of hospitals. So we have different missions that we work for and we share about. And when we share about them or propose activities around them, we find partners. And so some of the groups that join us can be directly from health and care systems. They can be associations, they can be funding or foundations. We also have, quite different discipline professional groups that maybe find us. So it really opens up the space for a very diverse set of partners that then work together around a specific mission and a transformation process that evolves from that. And what would be our role? Because I guess as designers, and I don't know if there are other designers in this community, I'd love to hear from you guys too. What we've found is that we can actually play a variety of roles in these transformation processes. So we are often facilitating or convening, using visual tools and participatory design methods to really gather voices and not only to frame and define a challenge that we want to work on all together, but also to drive that through in engagement processes that engage citizens and professionals and various stakeholders in gaining ownership of the transformation itself. I think we're often the red thread. Our projects they've got longer and longer over the years. I think the average amount of time we might spend is anywhere from 2 to 5 years within one particular transformation journey, and we might be the one red thread between different partners coming in. So I think we kind of hold the original intention of the work, but also try and support different groups doing their part to drive the change. We, decades back, I guess, were using design thinking within the healthcare space for more service or product innovation. And what we realized when we looked at the programs and projects that actually had a structural impact within a system and on a system level, we realized that our practice is not well defined by simply talking about design thinking. And so we started to analyze, what had worked and trying to build that up as a distinct practice that we call care-centered design practice. And it is, we were talking about this just at the beginning with Anne-Marie. It's not a methodology as such. It reflects an attitude and also an approach that puts care as a value in this transformation process. So that means it's not only what we're seeking to create and co-create, it's also the way in which we drive that process and transformation, because in order for it to be effective and impactful and meaningful, ultimately it's not our process. It needs to be owned by the system and the stakeholders and the people themselves. And so it matters as much to us what we do as how we do that. And so this process has 3 main stages. It's not a formula. These are long, bumpy rides. But they usually start by, as I said, finding partners and finding a challenge that we're all going to work on. And aligning around the mission, but also the values. So there have been times where we've met partners and it hasn't worked out because we're not really interested for the same reasons. And so when we do find partners where we align in terms of values as well as mission, we can forge very, very strong partnerships that can withstand the bumpy ride, let's say, of these processes. The design step includes, of course, design thinking methodologies, but not only. And I think increasingly we've been trying to develop more and more participatory engagement tools, both online as well as in person, and how to choreograph those and to engage people in a careful way. And finally, the sensing the change, the final part, has really come about because we really would like to be there to see what happens in order to learn. And so we get involved and we become kind of gardeners in this phase. I'll talk about that in a second, where we're supporting teams as they implement and develop and nurture the ideas and solutions that they've co-created. The kind of scattered line around the outside is because And usually these sort of changes and missions that we're working for are never solved in one project. And so we're quite ready to imagine that we might work, for example, in end-of-life care, as we have done for more than 10 years, but with different interventions. So each intervention sort of moves the needle, and it takes time to do that. And so we see programs of work as opposed to standalone projects. Our past, as I said, had been in product and service innovation. And we use this metaphor of thinking of systems in a very organic way. So we think about a plant where above the ground you have elements that are visible, and below the ground you have the roots and soil that are invisible. And I guess when we were looking at very tangible outputs, new products, new services, and how people interact with those, we were really concentrating on interventions at this level of the stem, the leaves, the flowers. But we came to realize that even with the best intentions and the best outputs at that point, it's very difficult for new solutions to really embed in an organization. There was always an element of the organizational culture that either made or broke, the outcome. And so we decided to look at that more invisible layer, the roots, and what's happening, and how do we intervene in organizational change along with the innovation and solutioning that would emerge. As we talked and worked with various organizations, we started to see, well, hang on a minute, there's many things they can't control in the system. There are underlying conditions, there are policies, there are things that happen. The pandemic is a great example of situations that change out of anyone's control. And that in itself, that soil can also affect how well a plant might thrive or what happens within an organization. So this kind of gives us a very useful metaphor for navigating and having conversations with partners, but also around our intention as designers. What is it that we need to design and on which level? And how do we work with partners across multiple levels? Because it's really impossible to do this on our own. Okay. So now I think we have a little bridge to explain for you. Our practice is split in two main areas. So care system transformation is what I'm going to focus on today. And that, of course, is work that is done in very specific systems with very specific objectives, mission, intention, and quite a lot of constraints. And so we have another space which we call care dialogues, which is our exploratory, more research space where we can dive into topics around care and we can develop design provocations. And I've got some examples of work that we're doing there, because we really believe that the two feed each other. And that dialogue with stakeholders and with the system can actually feed into the way in which we might support transformation within systems. So with Rosina, we were discussing and preparing, wanted to bring a few case studies, I just want to give a little bit of context on each, and then maybe just pull out one specific insight that it could be nice to share with you. And I'm really curious how this resonates with all of your projects and work. So this is a program that we have been involved with pharmaceutical, Boehringer Ingelheim, and the NHS in England. We've done two different projects with two different parts of the country looking at chronic disease care pathways. And the idea is to try and understand end to end the service that a patient goes through, in this case with heart failure or with chronic kidney disease, and all the touch points within an integrated care ecosystem. So the integrated care boards, for those of you that maybe work or know the NHS structure, include different levels from primary care, secondary and tertiary care, but also social and community care. And so we're engaging stakeholders in a process to understand the current experience, the lived experience of the care teams and patients and their carers throughout such a journey, but then also involve them in identifying how to transform parts of that journey to really optimize not only the clinical outcomes or the cost effectiveness, but also the experiential impact of what someone is going through. And so this program was the sort of first foray for us as a team to engage with a territory. So you can see the Greater Manchester area was one of the projects that we did, this one for CKD, and looking at the variation in challenges across the territory that the system might have. And the main insight, I think, here was when we were in our second project looking at chronic kidney disease with the Greater Manchester team, we started to reach out through partners to find patients and carers willing to join, and we were oversubscribed. And of course, we have a certain amount of time that we can be together in workshops, and we just had way more people than we could support. So we needed to adapt the approach. But it was a realization for us that we had tapped into something that really felt like people power. So many patients and carers wanted to be there, wanted to be heard, had their stories to tell, and they needed to have a voice. And so one of the outcomes from this project was there were 7 different opportunity areas for the service to consider improving the patient journey here. And we added an 8th one, which was called people-powered care. The idea that that mobilization that had begun in that workshop could become a structural element of the way in which the NHS would move forward with any kinds of transformation work in this space. And that inspired us, and I think it inspired our whole practice like 2 or 3 years ago to move in this direction, position around people-powered care system transformation. So fast forwarding to last year and a project in Catalonia, and Ada here from our team is leading the second phase of this piece of work. We're working with the digital transformation team of the Catalan health system, and a very bold project that we call our Sagrada Familia project. Any of you that have visited Barcelona might know what I mean, in that we are just here to do our part of a much, much bigger transformation effort. The idea is to enable and create a future electronic medical record for Catalonia, so for the territory, that is integrated, so integrating health and social care and community care, that is person-centric, because we all know that that's the only way it makes sense, and that is longitudinal, which I think is one of the unique elements of this project, in that we need to see how an electronic medical record can journey with someone through a lifetime, literally from birth to death, so through life stages. And so with that kind of bold intention, we were involved last year in what we call a mass participatory exercise. You see the dots on the map. We went out to 28 different locations, from more rural settings, suburban and urban settings, to again engage and listen to stakeholders from across the system, professionals that rarely get a chance to stop and sit together in a room and talk with one another and share, but also to hear patient and carer voices. And again, this process was, the purpose of it was to co-design and create a set of design principles that you see on the left-hand side. These 10 design principles are now being used to shape the next step of the project, which is to start building the technical models of new processes that will then lead to input to creating the new information system. So as we engaged with all these different stakeholders, and I guess the main insight for us on this project that was at such a scale, and working directly with the system, is the navigation of the various politics and timing of funding and support that happens on that more structural level. This is not something that our team was capable of navigating, and it's not our expertise. So the need to really partner hand in hand with the digital transformation team was critical, and they were able to direct the project together with us so that we had room to do this mass participation exercise. And so I really feel it's a testament to the power of partnership, and also realizing where everyone's strengths are and who needs to push on which level of the system. So we were working bottom up and they were working top down, but ultimately we're working hand in hand. A similar story and a project that's much earlier in its, it's in its toddler years, I think. This is, again, a multi-year effort, and we're just completing the first year. It's with a foundation in País Vasco, in the Basque Country, called Euskampus Foundation. And they approached us because they had taken on a very bold mission to transform cancer care. And what they were looking at was how could it be possible to wrap lifestyle support around clinical treatment. So let's not just think about radiotherapy, chemotherapy, surgery, etc., but how can the standard protocol for anyone affected by cancer in the Basque Country include nutrition support, emotional well-being, and also physical exercise. And there's growing evidence, scientific evidence, that they were uncovering, because they're part of the university research ecosystem there, research that proves that this can actually make a difference. And more than that, it can impact the lived experience of people affected by cancer. So in this project, we are really at quite an early stage, but the timing has been very crucial, because the European Cancer Mission has set itself a target 2030, I think, to have 70% of cancer survivability. And so in País Vasco, we know that 1 in 3 people will be affected by cancer in their lifetime. And so now we're looking at how do we build out from the blue healthcare system out towards the social and community care, which is the green and yellow spheres. How do we build out touch points and nurture relationships, as well as shine a light on those initiatives that are trying to bridge these spaces and provide people with a continuity of care when they're affected by cancer. This is a project in Singapore. We've done a lot of work with the Singapore government over the years, and it was a project with the Lien Foundation, again, a philanthropic foundation, tackling the challenge of dementia care and wanting to demonstrate and implement a new model of dementia care that is community-based. So we worked with this area of Singapore called Ang Mo Kio, this particular neighborhood, and the visual that you see on the left is just sorry, it seems to be flashing, but it's showing a dementia daycare center. So our partners are running this center, and they run various centers like this all across the island. And they wanted to enable the ecosystem around their center to support persons with dementia in contributing as their disease progresses. So still feeling a valuable part of the community. On the bottom left is a cafe that was part of a new space that was co-designed together with architects called the Living Room, which is kind of beyond the center, but in the community. And the idea is that it would be co-run by persons with dementia and their family caregivers. It's a resource center, it's a meeting point. They can start to develop the programming that matters for them and that makes sense for them. And it's beyond the kind of clinical setting of a dementia daycare. And I think one of the biggest challenges with this project has been shifting the mindset of the service provider, which is called AWA, from seeing themselves as service providers to seeing themselves as having co-responsibility for supporting persons with dementia. So we wanted that living room space to ultimately, the community has a set of keys. And one day, you know, they're the ones opening up that space and running that space, but it takes time to get to that point. So this project launched last year, and so we're watching and learning how the team has been implementing and developing some of these ecosystem solutions over there in Singapore. And now I think it's the last one. I'm not too bad with time. This is the last example. It's quite a different effort. This is over on the right-hand side of our practice, where I said design dialogues and yeah, some of our more design interventions play a role. This is a festival that is called Life at the End of Life. And last year we co-organized the first edition. And what you can imagine is a series of programming that happens across the city, across Barcelona. Last year it was in May. This year it's about to launch at the end of October. And we will be enabling different groups and collaborators to come together to run a very wide variety of activities, all with the intention of breaking the taboo around talking on death, dying, and grief. And so we have workshops, we have talks. The image on the left was an incredible event organized by the design school Bao. They happened to have a Buddhist monk passing through exactly when the festival was happening and convinced him to run give a talk to share on the perspective of death and dying from the Buddhist kind of point of view. We had cineforums, the image on the right. We had a series of movies running in local cinema and also online with filming. And following the presential movie screenings, we had debates and invited people. This is a lady that was with ALS, and she was one of quite an advocate for euthanasia. And actually this image was taken a month before she passed. She was sharing here with her husband about having taken that decision and what it meant for her, and the right, you know, to take such a decision. So it was a very, very powerful, moving event. And the films were there to really open up topics, and then we would debate. We were on the metro system. We're going to be there again this year for 5 weeks, running with the little TV screens that are in there, triggering people to think, you know, what is a good death for you? I would love you guys to also participate. There's can share the website for the conference, for the festival. And there is a space for you to go in and read other people's reflections. And we really want to sort of drive this societal conversation, and for events like this to become annual programs here in Barcelona, but also in other cities. And so this is absolutely, it's driven by passion and the partners that we're doing this with. There's a team of 5 different organizations, and a lot of it is also through volunteership and some funding. But there's not enough money for this type of effort. So we're sort of on a mission to find funders to make this a sustainable campaign. And that's it. So thank you very much. Check out everything that we're up to and reach out if you would like to collaborate or want to share. We always ask people to share with us what is care for you, because we don't believe in providing a definition. And if you go here to this website, whatiscare.org, you'll see what people have shared from all around the world in different profiles and cultures. And it's a very inspiring depository of insights. Thank you very much.
Thank you so much, Leszek. So that's the first part of the presentation today, but just to make sure we have enough time, I want to hear from Rosina and the work she's doing with the Living Lab for Health. And then we will open it up for questions and have a discussion on what we've heard from the 2 different programs of work that are happening. Thank you. Go ahead, Rosina.
Thank you. Thank you, Lesh, for this wonderful presentation. I'm going now to present you the work we are doing from the Living Lab for Health at IrsiCaixa, which is located in a hospital in Barcelona as well, where we are aiming to transform health and food systems to address our complex health challenges. And well, IrsiCaixa is a biomedical research center mostly focused on diseases that have to do with the immune system, immunopathologies. So let's start with an introduction. We want to transform health systems, but we know that in many of the challenges that we are trying to address, like, for example, most of the projects during the last decades have been focusing on cost control, efficiency, quality of the health system, affordability, acceptability, and accessibility mainly. However, as we can see in the system map, health system is complex, and therefore what we see is that even though there are many efforts to transform it, these efforts do not have the impact that we would like to see. At the same time, in the food system, we are facing something similar. We see here another system map where we can see how complex is the food system, and we can see many of the challenges that different stakeholders around the world are trying to address in order to improve the performance of this system. But again, we are not seeing as much impact as we would like because of this complexity that we see in this system as well. And what we can see is that in both systems, we are having many systemic barriers. For example, in the health system, we can see barriers such as medicalization, the focus on cure and care over prevention, the prioritization of technological innovation, the central place of the hospital at the expense of primary care, the compartmentalization of health problems, neglecting interactions between body, mind, life practices, and life conditions, the lack of attention to diversity, accessibility, or distributional issues, limited patient autonomy, predefined educational interventions for health promotion, and so on and so forth. Regarding the other system, the food system, we can also see loads of systemic barriers. For example, the focus on large quantities at low cost, the intensive agriculture model with high-yielding varieties and chemical inputs, the fragmentation as well of the problem and the solutions, the domination of a few powerful groups, asymmetrical distribution of cost during the value chain, the obesogenic and unsustainable food environments that we have defined in our neighborhoods, the predefined educational interventions again, and the low priority for demand side policies focusing on food environments. So seeing all these systemic barriers, what we see is that we are all, and here I guess most of you are also developing research projects or innovation projects, and we all face that these projects sometimes do not have the impact we would like, and we are not able to scale them as much as we would like because there are these systemic barriers here. But these systemic barriers are not only the ones I mentioned before regarding the food system and the health system, but they are also embedded in the approaches that we are launching with our research, the way we perform our research and the way we perform our projects. And Les has already talked about the approaches and the methodologies they are developing, not only with system thinking methodologies, but also innovating in the way the engagement process takes place. As we all know, these systemic barriers are embedded in the system's structures and are shaped by the stakeholders, but they also at the same time influence how the stakeholders act. And therefore they are critical to be addressed in order to be more successful. In the way we address this food system transformation and health system transformation, therefore, there are the other systemic barriers. These are the systemic barriers of the research and innovation system. And these barriers refer to the fact that our research and innovation system is fragmented in different disciplines. We tend to have too much linear thinking, not of course in this network, but in general. We lack the involvement of different stakeholders outside academia, and then we lack incentives to move from the current research and innovation model to this new model that is needed. And as a result, we are lacking impact. We can see this death valley between the creation of proof of concept and then the scalability and implementation in the market. We also see that there are many needs that are unmet. We see also still too much focus on technological innovation, also lack of funding for this sort of approaches, problems of social acceptance, for example, of vaccination and many other problems of social acceptance, and then persistency of challenges because they are complex, because of the complexity that we face in the problems we are trying to address. So we all agree, and that's the reason why we belong to this network, that we need a new way of problem solving. And that's why we are here in this network. So we need a way of problem solving that is more systemic with system thinking approaches and is more participatory. And we have come up with these characteristics of the approaches that we always promote. On the one hand, they need to be click, and this comes from one of our projects now, which is called Food Click, which calls for interventions that have benefits at social level, at economic level, and environmental level. So the three aims of sustainability that promote linkages between urban and rural areas, that are multi-stakeholder, of course, and that are cross-sectoral. So not only health, but also with the food system, with the education system, urbanism, social services, environmental services, and so on. The approaches need also to be multi-level, so involving neighborhoods, municipalities, city regions, national and international. They need to be responsive with the capacity to adapt to the complex adaptive system where they are embedded, and therefore identifying and addressing the systemic barriers that we mentioned before. They need to be designed with iterative processes, and Les also talked about that. They are not one-off interventions anymore. They are programs that should be sustainable in the long term, and with these loops of learning and action. And they need to combine interventions with policy innovation in order to embed the principles of our projects in the current system. And I think this last one is last but not least. It's very important that when we finish one of these projects, we make sure that the principles of our project are embedded in the current system and do not finish once the project ends. Okay, that's very nice, but how can we address all these system characteristics of our approaches? We have created a tool that we published very recently on the Clever Food website of the Clever Food project, which is a European project, where we design how to design a multi-stakeholder and multi-level strategy for system transformation. And we suggest these phases here. A first phase where we develop system understanding and a future vision, shared future vision, and also we identify current initiatives that are starting to change the current system in this direction, and we create what we call a creative tension between the present and this future situation. Then we move to the phases 2 and 3, where we develop some strategizing activities and programming activities. And finally, we move to implementation. And after that, once we start having some data through this implementation and the evaluation that it also has, we move to phase 5, where we start with policy innovation process in order to make sure that the principles are embedded in the current system. And this is a tool that we will publish next year, early next year. This tool here is already published here. We will share the video and you will be able to click here and visit this tool. This tool is based on a methodology that is called the System-Oriented Dialogue Model that we published recently in this journal here, the International Journal of Public Health. And we designed for this methodology these steps here. And so basically what it gives is guidelines in order to organize a very multi-stakeholder and diverse group of stakeholders to be engaged in an iterative process in order to co-design a strategy, then implement them, and then reflect on how to embed the principles of the new strategy into the current system. And as you can see, the phases in the consultation phase, we always embed system thinking methodologies, and then we integrate the knowledge that comes from the different workshops that we run during the consultation. Then we do new workshops to prioritize, and then we program, disseminate, and implement. What is very important for us in the consultation phase is that we embed, as I said, system thinking methodologies in order to make sure that we identify, as we said before, the systemic barriers, and therefore that we better address them and design modifications to produce the desired effects. Our experiments implementing these sort of approaches, in some of them we also carry out research, and we have started publishing on them because we see that there is a lack of standardized norms and methods on how to approach this different way of developing research and innovation. So the core activities of the Living Lab for Health are the ones listed here. On the one hand, we facilitate and we give support to ecosystems of stakeholders who are doing research and innovation. For example, we give support to ecosystems of stakeholders doing prevention and health promotion, also to those developing new biomedical tools for diagnosis and for treatments, for example. And then in the challenge 3, we give support to those developing biomedical tools in order to combine them with supportive care tools and therefore move towards a more integrated care approach. And as I said before, we develop research on these activities that we perform with these ecosystems, and we also offer training and dissemination. So now I'm going to summarize these 3 challenges, some examples of projects that we are carrying out within these 3 challenges. In this slide here, you can see the 8 European projects where we are now collaborating with these ecosystems of stakeholders, and we also collaborate with other stakeholders giving services to them. So for the challenge number 1, new approaches for prevention and health promotion, for example, we are carrying out one project which is called Allison Community. We are creating a network, a multi-stakeholder and sustainable community called Allison that applies systems approaches and takes into account the complexity of the system where we are intervening. And basically what we are doing with this group of different stakeholders is to transform local food environments. Why? Because we realize that current interventions to change dietary habits, for example, so to tackle, for example, obesity and overweight, are not being successful. And we have a pandemic of overweight and obesity all over the world. And we realize that the hypothesis here is that we can no longer intervene with predefined educational interventions, but we need more complex and systemic interventions that take into account this complexity and that also take into account other elements in the system, not only education, but, for example, improving accessibility to healthy, sustainable, just, affordable food, and therefore transforming local food environments in vulnerable areas in Barcelona. At the moment, we are doing that in 2 neighborhoods in Barcelona, and we have created this network of local partners that you can see here, or this community of local partners, in collaboration with 4 European projects, and we are doing different iterations together with them. We have done 3 iterations to develop some system understanding in the 2 neighborhoods. As you can see here, we have also conducted visioning activities and strategizing, like, for example, using the 3 horizons framework that some of you may know, which we have made it evolve by adding in it a system analysis tool. And we have also performed some co-design activities in order to come up with this intervention here, which basically is an intervention that aims to engage community connectors, to create small communities of citizens who are offered different community infrastructures. For example, a food surplus management program, participating in food buying groups, in food and nutrition learning activities, in community kitchens to cook together and then bring the food at home, or in community-supported agriculture activities. And these communities are also invited to participate in an entrepreneurship program in order to develop their own entrepreneurship initiatives. And this goes hand in hand with an innovative policy process and also a platform, and then strong monitoring. And this process, this project has been designed with more than 100 organizations that have participated in its design. Here you can see some pictures of the implementation, the pilot implementation that is taking place in the 2 neighborhoods at the moment. And next, in December, we will start the 5th iteration of this process, where we will perform this transformative innovation policy process. We have done a mapping of innovative policies that are around the world, and we will bring them to the first cycle of workshops to design desired policies and identify systemic barriers to achieve them. And in the second cycles of workshops, we will be able to prioritize among these desired policies, locate them in a framework that we have that describes the different phases that are needed in order to achieve policy innovation. And when we understand in which phase we are, we will be able to design recommendations in order to achieve this policy innovation. Depending on the phase we are, they will be more towards the policy or with previous actions that will be needed to achieve this policy innovation. And we will also have a strong dissemination campaign run by a network of cities in Europe, which is called IrsiCaixa. Another of the projects that we are carrying out is the one on health promotion. And here we have two different programs, one for mental health promotion and one for prevention of infectious diseases. And here we have, again, done different iterations of the process that I described before. In a first iteration, we performed a diagnosis and we designed what are the systemic goals that a school should fulfill in order to become a school that has a systemic approach to promotion, to health promotion for mental health, and to prevention of infectious diseases. And based on this analysis, we could develop educational guidelines that are being used now in a second iteration and are being piloted with more than almost 3,000 students and their families in different schools in our area. And in a third iteration, we are exploring how we will be able to bring this to scale it up in more schools in the country. Regarding the second challenge, here we are promoting these innovative approaches in the development of biomedical tools for diagnosis, for prevention and treatment, but they are concrete biomedical tools. And here we are working with these projects here. For example, we are working with a group of different groups of research that are working on immunotherapies in order to understand the complexity of the problem they are trying to address. We are also working with an ecosystem of different stakeholders, including patients, but also different hospital services and primary care and researchers working on long COVID, which, as you know, is a very complex condition, and therefore this requires a systemic approach as well, and we are helping them to improve the way they learn from each other, and therefore they design their solutions. We are also doing some projects on patient experience, for example, for designing a protocol of supportive care for a future project. And then we are also performing policy innovation processes in order to explore how to make sure that, for example, in this project here, we are developing a vaccine against the West Nile virus to make sure that the localities where this virus is emerging will have policies in place to supply the vaccine to the local populations that are suffering from this terrible infectious disease that is emerging around Europe at the moment. And here you can see a slide just with some pictures to summarize what we are doing, for example, with this long COVID network, mapping, doing some system mapping, identifying again systemic goals, and developing a network for addressing these very complex challenges in collaboration. And last but not least, with Challenge 3, we are doing the new approaches in trying to make sure that when researchers are developing biomedical tools, they are doing so with integrated approaches. And for example, here we are working with a very interesting clinical trial called Pragmatil, which is an immunotherapy that is being tested in a clinical trial all around Europe, again with a European project. And here we have created a patient advisory board, and we have analyzed needs, barriers, and opportunities in order to improve clinical trials like this one. And based on the results, we have been able to co-design a patient booklet in order to improve the communication through the different phases of the clinical trial, and a supportive care tool with a repository of different tools, existing tools, and a priority setting tool for patients to be able to explore their needs and prioritize the supportive care tool that they would like to use in the supportive care toolkit. And as a conclusion, just to finish now, we believe that in the health system and in the food system, we still have loads of initiatives that are brilliant, but there is a huge need for more collaborative and systemic approaches, and that with tested methodologies and also putting a lot of attention to political commitment, we will move faster towards a more effective emerging system. And I would like to finish with this slide here. This is as some of you may know, the Millennium Bridge in London. It was opened in the year 2000 when I was living in London. And after some days of the openness of this very famous bridge, because it was designed by Norman Foster, the bridge closed. And that was because people were walking on the bridge with a similar frequency when they were walking, creating a resonance on the bridge that the architect, the famous architect, couldn't predict. And this shows, in this case, a negative effect of collective impact, but that can be as strong as closing as such a famous bridge. And we expect that with this network, the System Innovation Network, and the reflection that we would like to open now with the audience, we can explore together how to accelerate this transition towards this collective impact that we would all like to see faster in the health system and also in the food system. Thank you very much.
Thank you so much, Rosina. That was a lot of content that we just went through in the past 50 minutes, but thank you so much. While you're both working on distinct initiative, I found there's a lot of commonality in kind of the approaches and what you're learning, how a lot of these initiatives designed to do system change require like multiple and several partners. And I think I also appreciated, Leszek, your comment about it's not just about the tools and the processes we use, but it's about that mindset and whether or not there's alignment on it, and how we choose our partners or how to work. That's an important foundational piece. I know we only have a few minutes, and here's what I'd like to propose. So as you know, we run these webinars trying to promote the use of systems thinking to advance system change in health. What I'd like to do is, I would love to hear two things. One is we can engage in a Q&A with Leszek and Rosina, just to learn a bit more if you have any kind of burning questions about their work. But the conversation does not need to end at the hour today. So I would love to get ideas on how would you like to continue the conversation? What are other things that the SI Healthcare Hub could facilitate to continue this conversation? If you have ideas, please put those in the chat. And as folks put that in the chat, I was wondering if anybody wants to raise their hand or they have a specific burning question to get more clarity on these great examples or case studies of real work happening to change our social and healthcare systems. So yes, go ahead, Aman.
Hi, good evening, good afternoon for everyone, and thank you for the amazing presentation to start with from both Lakshmi and Rosina. I'm here as not a healthcare practitioner or a care activist, as you mentioned, but I am a systems thinking practitioner in my field, which is organizational design in the tech industry. And I was, my burning question here was related to similar notes that you both mentioned, trying to find monetization models for such initiatives from inside to trigger change from within a certain system, in your case, the healthcare system, and to trigger some changing processes towards more care, more collective systems thinking approaches, is tedious, long, complex, and difficult. And in many ways, I'm based in Germany, where bureaucracy is very, very tough, maybe tougher than in your cases, but I would love to learn some of the inspiring moments where you were able to land on, I don't know, a fund or a crowdfunding, or how did the beginning of those efforts started to grasp momentum, whether in terms of dealing with the bureaucracy of governments and allowing such, convening such workshops with the public, or with the funding. So monetization and Genehmigung, we say in German, like the permits, so to speak. I'm really curious about both initiatives, actually, to hear from both. Thank you, guys.
Thank you.
I'm muted.
Nice
Shall I
to
go
you.
or? Yeah, great question. I think it's something we're racking our brains about every single day. So what I can tell you is some examples of how some of these transformation programs got off the ground. Sometimes it's about timing as well as connection. And as I mentioned with the Busy On project, and actually Marta, who's leading that program, is on the line too from our team. The timing of that is
Oh.
such that the European level, there is a mission around cancer, and we have 6 years to move on it. So that also creates a certain context in which the opportunity can emerge. It doesn't make it instantly easier. Nobody's throwing money at us just because we say we want to do this. But you can use that to build an argument towards engaging with government teams and system teams, because they are also having to deliver on those targets. And so aligning the mission, in this case, Bizion, around those national and then European level targets is very helpful in driving momentum, and obviously then building bridges to the groups that are delivering on those can help to drive things. But I think the other example that's in that program, but is also with some of the work with the Singapore government and Singapore stakeholders, has been that the challenges and the missions that we're working on at the CareLab are really universal pain points for a lot of governments and systems. So there's no doubting, the issues around chronic care and the disease burden, or around cancer care, or around health systems not coping, in the current model. So the need for new models. And then we've been lucky to find champions, and sometimes it really boils down to individuals who are willing to challenge the status quo, and leaders at that level within organizations, but also within government working groups, who are ready to take a risk. And by that, and where I think we've hit a wall, and you talk about bureaucracy, is I think in most of the work, we are challenging the traditional procurement processes. They exist, and there are certain hoops that you need to jump through. But when you have partners that know how that system works, and you learn by doing, you figure out how to make what you're trying to do fit into the way the system is set up to get in the door. But procurement needs an overhaul, but that's a whole other webinar, I think, or another topic, right?
And thank you, Lesh. I wonder,
Yeah.
just to make sure we wrap up on time, I'd love to hear quickly from Rosina on this topic, and then we will have to wrap up because there's another meeting starting at the hour with another group. So Rosina, if you want to just share your answer to Aman's question, and then we'll wrap it up.
Yes, well, thank you for the question. In our case, we have recently come up with a framework that is very interesting, which is from the Netherlands, from a university in the Netherlands, which describes the different phases in a transition. And this helps us a lot to understand that sometimes we are not going to achieve the impact because it's too early. And we may be only developing a niche initiative, and with this framework, it describes what you can do next. But don't expect to change a policy or scale up, because after that, it's too early. We are here at an early stage of the system thinking new paradigm. And in order to achieve it, we need to be aware that there are different phases for this sort of transformations, and this sort of frameworks, which we can perhaps talk actually in another session if you are interested. We can invite somebody to present it. It helps you a lot to understand that perhaps the next step is not to already embed it in the system.
Wonderful.
I could put examples of next steps, but we don't have much time, so maybe we can organize another event for that.
Absolutely. I'm just seeing from the chat, and I won't read them out, but there's a lot of great ideas on how we can continue the conversation, Lesh, including one around procurement. So we will be following up with all of you. Stay tuned. If you are not a member of the SI Health Hub, you can join. And we look forward to seeing you to the next session. So thank you, everybody. Thank you, Lesh and Rosina, for sharing the great work you've been doing using system thinking approaches.
Thank you very much for having us. And I
Thank
dropped
you.
contact in there. If anybody has more questions or wants to share, feel free, reach out.
Wonderful.
Thank you, Rosina.
Thank you. Take care. Bye.
Bye.
Bye.